Hello viewers, welcome back to my session. We'll talk about mechanism of injury in vascular trauma today. Vascular trauma, how do we divide it? What are the types of and causes of traumas we can think of here? First we'll talk about the causes of trauma. Three major causes which can cause vascular trauma are automobile accidents, urban violence, and iatrogenic injuries. Now, what is iatrogenic injuries? Injuries sustained during the hospital procedures within the hospital. So, they are iatrogenic injuries. Automobile accidents, we all know. Road traffic accidents, we are all aware of them. And urban violence could be anything: street fights, road rage, rioting, any acts. These are the three major causes which we will talk about. But what is the incidence of an artery, where the focus of this book is artery? What are the incidences of arterial injury in these situations? Initially, it was about 3%, and now it's about 1.5 to 2%. And why this becomes important is because 1.5 to 2% is not in hundreds or thousands, even lakhs. We're dealing with a population that is in crores worldwide. So even that minor 1.5 or 2% makes a lot of difference. Moreover, medicine now is a very high risk industry. We are all aware now. It's something like aviation basically. But the chances of dying in an aviation accident is 1 in 2 million, while the chances of dying in a medical incident is 1 in 200. So we have to be extra cautious about everything now. Also, there was with the advent of laparoscopic surgery, it has been seen that there have been some incidences of vascular injuries while the procedure is being performed. That is because it usually used to happen because of a various needle which we still use, and that needle is used to insufflate carbon dioxide inside the body to make adequate space for the introduction of laparoscopic instruments so that you can operate. And it's a safe procedure, but what used to happen was that that needle used to go directly posteriorly into the retroperitoneal structures, and in the distal aorta where it used to bifurcate, that needle used to sometimes go directly into the right common iliac artery, and that used to cause the bleeding. The second cause in laparoscopic was just injury to the inferior epigastric, which used to come in the way. But they are all manageable. These injuries, whenever they happen, you can manage them, and you might just have to convert to open laparoscopy. A laceration, you can see a transection, you can see intimal damage secondary to contusion, aneurysm, or you can have spasm. Then you can have an external compression injury, you can have a pulsating hematoma, false aneurysm, and you can have an atriovenous fistula. So these are the types of injuries which we can get. Okay. Now, what is a completely? You can have two types of injuries basically. If we talk about the anatomical aspect of injury, then either the injury is large enough so that the artery is completely severed. This is usually seen in a knife injury, missile injury, and what happens in this is that it forms a distal clot. So there is a disappearance of the pulse, which is usually the most significant and the only sign that if the pulse is not there, that means the injury which has happened above is a completely severed artery. Secondly, what you have is a partially severed artery. This you can get secondary to any drill point in orthopedics when you're drilling, while you're drilling. Or you can have it in a catheter while you're inserting a catheter, intravenously, or you can have it in a while you're putting a needle inside. So these, in this partially severed artery, the injury, it is basically going to form either a arteriovenous malformation or an aneurysm later on. Before I simply mention the simple and the complex vascular repair techniques, I would like to add two things in it. That is, what is ligation and what is fasciotomy. Ligation is a life-saving maneuver. When you're talking about ligating vessels, arteries which are bleeding, now you have to understand, suppose you have a bleeder in the hand and you have two arteries there. You have either the radial artery or the ulnar artery. If either of them is patent, please understand, if either of them is patent, you can safely ligate the other one. But in the leg, if you ligate the iliac, femoral or the common femoral vessel, there is a significant chance that the limb will develop ischemia. Subclavian artery, you can ligate if there is no massive kind of soft tissue damage around the shoulder. And if we talk about the external carotid, because neck injuries, external carotid injury, you can ligate. But if you ligate the internal carotid, there is significant chance of a neurological deficit. So these are the basic, I can just tell you briefly that what you can do in an emergency situation if it's a life-saving before a doctor reaches, or if it's a doctor himself, until he reaches tertiary care. And simple repair of a vessel you can do by just trimming the edges and just repairing it, whereas for large vessels you can either do a lateral repair or a end-to-end anastomosis or a graft interposition. So these are just some of the procedures that can be followed in case of a major vessel injury. So to summarize, a patient has come to you. Before you assess, you have to look at before you assess for your ABC, and if the patient is bleeding, you first stop the bleed, please. Obviously. And there are certain terms once you go and study all this, there have certain terms like triage and all these. So once you have identified where the bleed is coming from, major vessels we have just enumerated: around the shoulder, around the elbow, around the knee. Then we have talked about your radial artery, ulnar artery. We talked about lower limb arteries, iliac, common femoral, superficial femoral. Then we have talked about your subclavian artery, and then we have said external carotid artery and internal carotid artery. This is all I can tell you about in brief what you can do with it. Fasciotomy you can do if it is causing any compartment syndrome within the compartments. So if it is intracompartmental pressure is increasing, you can just put a stab incisions about 1 centimeters each and release the pressure from them and do a fasciotomy. That's all I can tell you right now. And it is just a brief one. It's a life-saving procedure. So this is what you have to follow. Thank you so much.